So April, tell us how you found Sunrise.
I was born and raised in this community, and I was not able to have health insurance out of high school. Started getting really sick, and through the resources of Banner Health at the time, I was able to get connected here.
And Lydia, tell us about your Sunrise journey.
So I started about 8 years ago, 9 years in November in 2012, fresh out of school, fresh out of college, and got my resume sent here and started off, and I've been here ever since and loving what I do.
Tell me a little bit about your story.
I started coming here about 20 years ago, if not more, just because I wasn't feeling very well. I ended up getting diagnosed with severe Crohn's disease because of our pharmacist at the time. She took really good care of me and made sure I knew all my options and helped me to actually get on a patient assist program. Failure was not an option for me here from any of our providers. And then a few years after that is when I lost my twin girls and wasn't sure what direction to go or where to go, and that's how Summit Stone was initially brought up to me and introduced through that, and I do the things that I do.
Nice.
Do what we need to do for you.
Yeah, that's great. Talk about that. Yeah, talk about the brain tumor and sort of the journey of that. That's good.
Okay. In 2017, I was starting to not feel good. I was having more and more personality changes, having more and more vertigo, and just things weren't right. And then the doctor that was here at the time was very, very proactive. He was not going to take no for an answer. And then within the next couple of weeks is when we found out I had a brain tumor. And then I could no longer walk on my own. And everybody here, it wasn't an option. I mean, it was always encouraging. Failure was not an option here. They taught me how to fight, so I knew how to win regardless of what that looked like or what that meant.
Wow, and so you had brain surgery at that point?
I had brain surgery October 11th, 2018.
Yeah.
And it took me about 5 or 6 months to rehab out at Hearts and Horses and some other things. And it was a lot of encouragement from here, a lot of resources, and always checking in, whether it was the doctor sending an email, just making sure that you're checking in the places you need to, or the nurses calling to follow up on different appointments for things I would have thought would have been trivial, but in the long run were the cornerstones of confidence in patient management and care. I mean, if you don't have a good medical team behind you, you will not survive.
Yeah.
Because especially here, our care team, our nurses and stuff, there are psychologists, there are moms, our dads at that moment when we need that support. They're any and every role. They're the doctor at that moment. They advocate to the doctors of what they see, or how they know that they watch us, they care about us, from this appointment to the next, on how we succeed or we're stuck, and where we may need to start moving stuff around. And that's how I got into Summit Stone Behavioral Health, because they were extremely proactive on making sure I maintained physical health, but also optimal mental and emotional, because they're so closely intertwined and connected.
Yeah, that's awesome.
I would not have survived if it weren't for this place.
That's great. How do you, if you had to describe Sunrise and LCHC in 3 words, what might they be?
Community, integrity, and fellowship.
Nice.
And there's no religious attachment to that at all. It's all about being an individual and mattering.
Yeah, you do matter.
People really do. They care about people here.
Yeah, that's awesome. So tell us what LCHC means to you.
It means integrity, which is all the assets combined, community, partnership, and most of all, just belonging, being part of something that matters.
Nice.
You matter.
For me, LCHC means giving back. We give back to the community every single day and never judge, and we're always here for the patient. The patient's priority.
That's awesome. And what about having an experience at a community health center? April, we were talking about that earlier. Can you share a little bit about that?
I had really awkward expectations given the demographics of what a lot of us fit into to qualify for here. But because of people like Lydia, I was able to understand what identity individually meant and what personal integrity meant, being a positive, productive member of society regardless of where you're at in life. I mattered.
How have you felt treated by Lydia and other members of the team?
I didn't know I could swallow pride for somebody else that I didn't have an unprofessional or like a more intimate relationship with. You know, not a lot of people look forward to going to their doctors, but here you're safe. Here it's okay. Here it's normal to be not normal. So
That's great. How about you, Lydia? What does it mean to work with patients like April?
It makes your day worth it. It makes coming to work every day worth everything you do. It's more than just work at that point. It's pleasure, and it's knowing that you're making that difference for that person each and every day.
you truly are. Truly do make a difference.
What other services, April, have you received here at LCHC that have made a difference for you?
Dental, especially having an active cardiac problem with congestive heart failure as well. They always make sure that I maintain optimal health and that I do get the treatment that I need, because it is so imperative. But more importantly, I've been able to maintain mental health through Summit Stone behavioral health, through all the trauma with being chronically ill all the time.
Nice. What does it mean for you as a provider, Lydia, to have those services integrated right into LCHC? Pharmacy, behavioral health. Speak a little bit about that.
It means we can make more of a difference than the normal clinic can, because we're a one-stop shop. We have everything in one location, so if there's any other barriers involved, we kind of eliminate those for the patient and give them every opportunity to take care of every little piece of their health that needs caring for.
Awesome.
Like, my goodness, summed it up.
Yeah.
I think we did.
Lydia kicks ass. That's
Oh, I'm just gonna leave that in the video.
like I said, I've watched
Here's
her.
the video. Lydia kicks ass.
Oh, I would totally be down for that. You know, I'd be like, hey.
Yeah, you would.
Or Lydia, right? And then
Well,
we'll have
people need to
margaritas.
know when they're doing well just as much, if not more, than when they're doing poorly.
And how does the team here help you know that?
Because they follow a strict standard of ethics and morals, and it's consistent. They show up. They're here when they need to be, when they say they're going to be. They ask how our mental health treatment plan is going in accordance with where we're at physically here. One of my favorite things about Lydia has always been, let's make sure we check and see what's going on everywhere before we ask the doctor about more medications. Because so many people are like, pills diagnosis. Well, it's multifactorial. Our bodies are so irreducibly complex, we have to tweak something here. And she helps keep our cogs turning well oiled.
Thank you. I appreciate all your kind words.
That's the truth.
Mm-hmm.
Thank you.